And I do see a lot of wear and loss of vertical dimension. I always ask them, are you tired during the day? Do you feel refreshed when you wake up? Especially for blokes like myself, males over the age of 50, our risk of developing sleep apnea increases astronomically. So when I see that in patients over the age of 50, I'm always asking them, have you had a sleep study done? Do you know whether you have sleep apnea or not? Because I think that addressing their sleep apnea issues can have such a positive effect on their life in general.